It was supposed to be a routine review of the state's voluntary assisted dying scheme. But what the investigators found sent shockwaves through the healthcare system and sparked a national conversation about the ethics of assisted dying. The scheme, introduced to provide terminally ill patients with a dignified and compassionate end-of-life option, had been hailed as a groundbreaking piece of legislation. However, as the review team dug deeper, they uncovered disturbing evidence of widespread non-compliance with the scheme's strict protocols. In one case, a patient had been given a lethal dose of medication without the required second medical assessment. In another, a doctor had falsified a patient's medical records to make them eligible for the scheme. The investigators also found instances of patients being coerced into ending their lives, and of families being pressured into supporting the decision. The review team's findings were met with horror and outrage by healthcare professionals, patient advocacy groups, and the general public. How could a scheme designed to provide a safe and compassionate end-of-life option have gone so horribly wrong? As the news broke, the state government was forced to act quickly to address the crisis. The health minister ordered an immediate suspension of the scheme, pending a full investigation into the allegations. The investigation, led by a retired judge, would take months to complete. But as the evidence mounted, it became clear that the problems with the scheme went far beyond a few rogue doctors or administrators. The investigation revealed a culture of complacency and lack of oversight within the healthcare system. It found that doctors and nurses had been given inadequate training on the scheme's protocols, and that there was a lack of clear guidelines and procedures for assessing patient eligibility. The report also highlighted the need for greater transparency and accountability within the scheme. It recommended the establishment of an independent oversight body to monitor the scheme's operation and ensure that it was being implemented in accordance with the law. As the investigation's findings were made public, there was a sense of outrage and betrayal among the community. How could the government have allowed this to happen? Why had the healthcare system failed to protect the most vulnerable members of society? The controversy surrounding the voluntary assisted dying scheme sparked a national debate about the ethics of assisted dying. It raised questions about the role of government in regulating end-of-life care, and about the responsibilities of healthcare professionals in ensuring that patients receive compassionate and dignified care. As the dust settled, it was clear that the voluntary assisted dying scheme would never be the same again. The government would be forced to rebuild the scheme from the ground up, with new protocols, new guidelines, and a new culture of transparency and accountability. But for the families of those who had been affected by the scheme's failures, the damage had already been done. They would never forget the shock and horror of discovering that their loved ones had been failed by the very system that was supposed to care for them. The government's response to the crisis was widely criticized, with many arguing that it had been too slow to act. The opposition seized on the issue, calling for greater accountability and transparency within the healthcare system. As the debate raged on, it was clear that the voluntary assisted dying scheme would remain a contentious issue for months to come. In the end, the review of the voluntary assisted dying scheme served as a stark reminder of the need for vigilance and oversight in the healthcare system. It highlighted the importance of putting patient safety and well-being above all else, and of ensuring that those who are entrusted with the care of others are held to the highest standards of accountability and compassion.